Hello and welcome to Antibiotics versus Strengthening, Strategize Your Lyme Recovery. I'm Hillary Thing. So for those of you who don't know me, I'm the creator of the Uprooting Lyme 6-month holistic treatment program, and I'll be introducing that to you today a little bit with our talk. And I'm also owner of the Accord Acupuncture and Herb Shop, which is located in High Falls, New York. That's where I have been practicing natural medicine for almost 2 decades. And I was born and raised here in this area where I now work, and I raised my family nearby. And we are in Ulster County of New York State, which is one of the top 5 counties in the country in terms of the highest rate or highest incidence for Lyme disease. So almost every member of my family has had Lyme disease. My mother, my father, my sister, and my husband. And they each have had, they each have a different story, different presentation, different experience with doctors, different outcome. And the more that I researched and came to understand what Lyme is and how it develops and why people get so sick from it, the more that I felt a need to speak out and to educate other people in my community about Lyme disease. And this is really how I became known as the person to go to for non-antibiotic treatment of Lyme in my community. And over the years, our community has grown to a national level and even an international community because so many people around the globe are looking to understand this set of diseases. They're looking for help. They're looking for, accurate information and also for treatment. And so, here we are, and welcome to the webinar. Thank you so much for joining us today. And before we really get rolling, I just want to mention that you are welcome to enter questions into the Q&A box at any time. And I'm going to go to our slides now. So hold on one moment while I do that. Okay, so I'm excited to share these slides with you in this talk. What I really wanted to communicate with you today is about the idea of strategy and strategizing your Lyme recovery so that we look at antibiotics and also the holistic holistic medicine through the lens of strategy. So I want to first just look at what strategy is and what that really means as we're dealing with Lyme disease. So strategy comes from the Latin word, the combination of 2 Latin words, stratus, which means to spread out, and aegean, which means to lead, as in to take agency. And when you put these meanings together, the spreading out and the leading and spreading out, it just gives this great visual, this great feeling of, like an army spreading out and leading. And so, that's really a wonderful image for how you want your immune system to be activated inside your body, and not that the Lyme's strategy, the Borrelia strategy of spreading out and leading is going to win. So we'll look at this more deeply. So strategy is often associated with the military, obviously. This actually works really well for us as a metaphor because Lyme disease literally is this invasion of a parasitic army of organisms into your body that seeks to dismantle the health and the wealth and commandeer your body's resources for its own needs to the detriment of your vitality and functioning. And Borrelia, which is the organism that causes Lyme, as well as all of the infections that come along with it, They each have their own highly strategic, highly effective strategies for weakening and evading the immune system, and to generate conditions inside your body that are ideal for thriving. So for example, Borrelia shares DNA with other bacteria to cultivate antibiotic resistance. Borrelia hides inside your body's cells as well as other bacteria's cells or biofilm in order to evade the immune system. Borrelia is also part of the way that it lives and dies is to release toxins to generate inflammation and the conditions of acidity, congestion, and decay inside your body, which is what feeds it. So that's just to name a few. There is more. I could go on and on about Borrelia's effective strategies for thriving inside your body. And this is why antibiotics alone do not suffice for many people with Lyme. It's also why, if your goal is complete recovery, a full reclamation of your health and your body, then strategizing how you're going to get there is crucial. You can't just, sort of take the antibiotics and expect that to be it. So, the reason is what I'm trying to convey here is that you're up against a formidable opponent. And I'm sure many of you are very aware of that at this point. So we're going to look first at the use of antibiotics as a strategy for Lyme recovery, and then at the holistic approach. I chose this topic because it comes up a lot for my patients, and the people who I work with are people who are actively pursuing a full recovery from Lyme disease through holistic methods. And periodically the question arises, would antibiotics be helpful for me now? Or if they're already on antibiotics, the question becomes, how long do I stay with them? So, Lyme recovery from chronic persistent Lyme disease can take anywhere from 1 to 5 or more years. And so to really heal fully. So obviously you cannot be on antibiotics for all of that time, or at least I don't recommend it. And antibiotics, this is because antibiotics are essentially destructive in nature, right? They're seeking to destroy the bacteria, which is good for you, but they also weaken your body. So this is why the strengthening strategy must also be put into place. So I want to share with you the criteria that I use in clinic every day with patients like yourself, in terms of helping patients decide when to, whether or not antibiotic treatment is wise for you at this time. So the first thing you want to ask yourself is, if you're presently taking antibiotics and wondering how long to be on them, you want to look at what's your overall trajectory of healing. Are you getting better? Are you staying the same? Or are you getting worse? So let's explore each of these scenarios a little bit more deeply. And first, ideally, you're feeling better and better. And this is signified by experiencing increased energy, for example, feeling a decrease in symptom intensity, and or a decrease in symptom frequency while you're on antibiotics. And then so long as you're on this upward trajectory, you want to stay with it. Stay on them because they are obviously helping you win for now. And that's the best case scenario. It's the one we all wish for. And there are people for whom the antibiotics are totally effective. But this typically occurs if it's going to in the shorter term for more acute cases of Lyme disease. You get infected, you take the antibiotics for 4 to 8 weeks, and then you feel better and you stay better. But if you're dealing with the chronic persistent Lyme with chronic symptoms, recurring infections, and recurring waves of illness, then it's already more complicated than that. So next case scenario is that you are essentially staying the same. You're reaching a place of no change, no positive response to antibiotics, whether that's after a little time on antibiotics or a long time. So this indicates that it's time for a change, essentially. Spending more time on something that's not making you feel different is not productive. And that's true generally whether it's pharmaceutical or natural. The caveat here is the question of time, and you need to give something enough time to test a protocol and not just jump from one thing to the other. You need to give a treatment enough time to test it, which will differ given on the type of protocol that you're testing. But for antibiotics, we would measure this in weeks, not months. So if it's not doing anything, then get off of it. Or at the very least, excuse me, change the combination of what you're doing. So we don't have the time to go deeply into the art of combining herbs and other products with antibiotics to make them more effective, such as by taking things to break down biofilm and to address the cyst form and so on. But if you're not experiencing a response to antibiotics, then tweaking your protocol in such a way as to help the antibiotics gain access to the bacteria as they attempt to hide and escape can make a significant difference. So I just wanted to point that out as well. And then, unfortunately, the worst case scenario, which unfortunately happens to a large number of people with Lyme disease, is that you're taking antibiotics and you feel worse. This is the most concerning and the most dangerous scenario because it's an indicator that you're losing the battle. And for any number of reasons, the antibiotics and or the die-off are wreaking havoc on your body and providing only minor, if any, benefit in terms of reducing the infection load. So if your body is not capable of handling the die-off, this indicates that you're not what I would call antibiotic ready. This means your body is not capable of handling the toxicity of the antibiotics or the die-off. And this is an unsafe and it's not a health promoting scenario. In severe cases of neurolyme, too much antibiotics in a person who's already very ill is potentially fatal and can cause irreparable damage. So too high a dose in someone who is not antibiotic ready is a serious concern. And even in my patients who are what I consider them to be antibiotic ready, of course, they're obviously still sick to some extent, and returning back to an antibiotic protocol, if they become too sick for that, the dose is too high. And taking breaks or lowering the dose is very important. So there are also some people who are just highly allergic, highly sensitive, and too inflamed to tolerate antibiotic medications. And so your body in this case just rejects the drugs. There's just no way to keep them in your system. There's nausea and vomiting, very bad rashes. Like your body is just, I see this as like screaming, wrong way, go back. And so in these cases, you just have to drop working with the pharmaceuticals for at least a time and go deeply into holistic treatment methods, like I will share with you in a moment. And you may handle antibiotics better in the future, or you may discover that you don't need them or that it's not the path to healing for you. So this is why if you are considering doing antibiotics, that it's crucial to your success to become antibiotic ready first. And this is one of the tangible results of participating in the Uprooting Lyme 6-month program, either first or concurrently with taking antibiotics, so that you have increased ability to tolerate and benefit from the antibiotics with much less suffering from die-off and side effects. So in this wheel that you can see here are the 6 major areas of holistic treatment that we cover in the 6-month program. And the ones that come first, we cover in the first couple months of the program, and then continue. This doesn't stop. It just keeps on going throughout the whole 6 months and beyond. Those are detoxification and correcting the digestion. So this means that we teach you how to maximize your body's natural capacity for cleansing and ridding itself of the toxins, the disease burden, and the congestion caused by inflammation. It means correcting the digestive system stressors that are feeding the inflammation and the disease load. And so these are the 2 major aspects of becoming antibiotic ready. The next question, the next question that I often talk out with patients is about whether or not to take more antibiotics. If you've been on them before and you're not on them now, there's often a question of, should I go back to them? Should I try them again? So in this case, we want to evaluate several things. Given the potential hazards that are involved in taking antibiotics, are the pharmaceuticals really necessary? So the way that I approach this question is, first, if a patient is doing well with our protocols of herbs and natural antimicrobials and the cleansing, work with food and other supportive measures, then I do not recommend doing courses of antibiotics without evidence that they are necessary. If using tools such as herbs and Rife machine and other methods is effectively creating mild herxing and the person is growing stronger and on an upwards trajectory, then I don't generally feel a need to push the person back into using antibiotics unless they are really wanting to do that. The next thing that I look at is, what is the evidence that the pharmaceutical antibiotics will be well tolerated versus poorly tolerated? So extreme caution has to be used with certain populations, such as the elderly, children, highly sensitive people of any age. So in regards to the use of antibiotics and medication, in general, Lyme patients seem to be considerably more drug sensitive than your average person. And it's possible that the low body temperature that is associated with Lyme and co-infections slows down chemical reactions, slows down the liver. Many people who suffer from chronic Lyme also have the MTHFR genetic mutations that make them less efficient detoxifiers. So there is, in general, a caution to start with lower doses, not go straight for the high or average dose with a pharmaceutical. And many Lyme patients experience negative reactions to medications because the dose is too high too fast. And this leads us back to what I just shared, which is evaluating your antibiotic readiness. And again, this is, how are your detox capabilities? Because if you already know that you are very liver congested and you feel toxic inside, and you've never really worked on this aspect of your health, then you want to do that before launching into an antibiotic regimen. And then also you want to look at the status of your gut health. And so I really look at, have we done enough work in these areas so that you're moving into an antibiotic regimen from a place of increased strength and stability with a greater ability to manage inflammation, manage die-off, and the toxic nature of the antibiotics. And when someone really is antibiotic ready and they return to antibiotics, it makes a huge difference. And there's so much more success and benefit to be gained from those regimens once you're in the right place. So next we look at, in general, have you been undertreated or overtreated? And so if you've not had much antibiotics in the past because doctors didn't believe that you needed them, then, or if it's been a very long time since you've been on antibiotics, and if I feel that you're in a good place to handle them, then I generally recommend trying them along with the supportive holistic medicine strategies. And in this way, see if we can't take advantage of the best of both worlds. Because when this works and you are taking full advantage of the best of both worlds, then that often is the most powerful and most accelerated track to be on to heal. On the other hand, if you are someone who has already had extensive antibiotic treatment, then I recommend waiting and working to develop your vital energy and your organ strength, restore your systems, restore your digestive tract, restore your detox capabilities, and work with natural non-pharmaceutical antimicrobials before returning to antibiotic regimens. And I also evaluate what infections are most active. So this is something that can be overlooked. This is based primarily on symptom evaluation, and this is where clinical experience is invaluable. We're having seen how Lyme and different co-infections, viruses, yeasts, parasites, and so forth present in many hundreds of patients. I can make a highly educated guess about what is most active in your body at this time. Because if it's not Lyme infection, it can be a real waste of time, energy, and resources to take antibiotics for Lyme at this time. And similarly, I evaluate which health disorders are currently most prevalent, because there are phases of Lyme recovery in which more is gained by turning away from the antibiotic strategy and towards holistic strategies such as hormonal support, dealing with heavy metal toxicity or toxicity in general, mold cleanup, building your vitality and energy and immune system, solving food allergy issues and strengthening the gut, addressing problems within the nervous system that are affecting the brain, the capacity for sleep and mood. So, you know, and doing all of this, of course, through holistic methods that are very powerful yet harmonious with the body. So as you can see, this question of whether or not to take antibiotics for chronic Lyme disease involves some complex considerations, and it's a decision that's very specific to your unique situation at a given time. So another great question that I'm often asked is, how do I know if I am herxing or feeling worse because I'm backsliding? And this is another fantastic question because it can be very difficult to discern. And I feel there's a misconception around many in the Lyme treatment community that you have to suffer greatly through treatment, which I do not agree with. What I look for when treating people with natural antimicrobials, and also what I look at when I have a patient who is also undergoing antibiotic treatment, is herxing in the mild to moderate range of discomfort. So this is what I feel is a healthy response, where the vital forces of the body are not being excessively compromised. So if there's an ongoing herx reaction that's generated from antibiotics, this can indicate that you will do better with a pulsed style of dosing, where you are on and then off, and then on for a period and then off. And sometimes this is measured in days or sometimes in weeks. But it's necessary to give your body time to recover from the die-off before taking the next dose. Another reason for doing the pulsing is to sort of trick the microbes into feeling like, the threat is gone, and kind of reemerge. So there's more than one reason to do the pulsing strategy. But it's very important when undergoing antimicrobial treatment, be it from pharmaceuticals or from natural methods, that the ups and downs are manageable, because otherwise, again, you're compromising your life force and your strength and your ability to recover, and your body will weaken from that, and that's what we don't want. A huge part of making it manageable is having effective anti-inflammatory activities in place through food, herbs and supplements, cleansing practices, and energy management, which is really the art of working with your mind and emotions and even the spiritual level of your being to reverse acidity, reverse inflammation, and energetic stagnation in the body. So this is the work that we do as part of the Uprooting Lyme Holistic Treatment Program, which is based on the understanding that your body's innate capacity to heal is an actual reality. It's a quantifiable force that is measurable through things like traditional pulse diagnosis, as well as your response to treatment. So for example, when you herx without recovery, or there is just a flatlining, like no response to different types of treatments, these are indications that your body's capacity to heal is severely depleted. However, when you herx and then bounce back up to a new level of energy and sense of recovery, then this happens because your body's innate capacity to heal has been activated, essentially. The treatment and the health practices are removing the obstacles to healing and supporting what the body is naturally meant to do, which is to heal and regenerate. So that's what we look to support through each aspect of the Uprooting Lyme method. And this is what will enable your body to respond to treatment with minimal herxing and maximum restoration of health. So issues, let's talk and look at issues with antibiotics from the holistic perspective. So, it's one thing to move into an antibiotic regimen with a watchful eye, and it's another to be unaware of the potential hazards, which can leave you in even worse condition with less ability to fight disease, with more inflammation that your body can't handle, and even more complicated health problems. And so this is really what you want to avoid. So considering the hazards of antibiotic treatment, again, you can see why solving digestive system issues first, strengthening your digestion first before going into antibiotic treatment is so critical, because with antibiotics, you are harming the organisms that are good for you in your gut and that help to keep pathogens, disease-causing bacteria at bay. So, for example, antibiotics can lead to C. difficile infection in the gut and other potentially antibiotic-resistant strains of bacteria, which can lead to a host of other stubborn health problems, infections, and such as terrible, unstoppable diarrhea. Another example is that with antibiotics, you may get yeast overgrowth. So researchers have shown that Lyme spirochetes can grow inside yeast cells. Antibiotics can potentially increase yeast overgrowth, which also then hide and feed the Lyme. So you see there's a way in which if you don't use antibiotics smartly and strategically work to avoid these hazards, that taking antibiotics can work against you. Antibiotics are very hard on the liver and the kidneys. They stress your vital organs, and each one has its potential side effects. So given what you're taking, I always use specific herbs to protect the vitality of the organs, and especially the liver and the kidneys. Keep in mind that antibiotics take an increasingly large toll on the body over time and can lead to a serious breakdown of the immune system and other body systems. Because the infectious organisms involved in Lyme are so treatment resistant and often hide behind biofilm, sometimes the antibiotics have negligible effects and against the infections and don't even reach their targets. So the best outcomes with antibiotics occur through a carefully targeted pharmaceutical attack that is used really for a short duration before the bacteria become resistant. And the final antibiotic hazard is the potential for antibiotics to drive the pathogen deeper into the system. This is why taking herbs that are warming and utilizing cleansing practices that encourage elimination and the expulsion of the disease out of the body is necessary to create a total resolution of the disease. So in other words, it's very important to be encouraging sweating, encouraging bowel movements, and encouraging urination, and encouraging deep breathing, all while being on an antibiotic regimen. Without that, you can have a temporary disappearance of symptoms, but the disease is now situated at a deeper level, where it eventually will affect the muscle layer, the nervous system, or other internal places. And I encounter this situation a lot, where a patient will say, well, I got Lyme 10 years ago, and I took the antibiotics. And I'll say, well, what brings you here now? And they'll say, well, I have, a lot of brain fog, and I have joint pains and fatigue, and do you think this could be the Lyme? And basically the answer is yes. You've probably carried the Lyme with you for all these years, and the present problems are still Lyme related, because in cases like this, the Lyme, where antibiotics were taken without the facilitation of the release of the disease out of the body, again, through herbs and cleansing practices, the Lyme pathogens can be simply pushed deeper into the body, where they cause you a kind of chronic progressive symptom, which can happen sooner or it can happen later. And sometimes the Lyme waits until the immune system becomes weak enough for them to wreak havoc in the body once more. due to reduced immunity with aging or other infections or car accident or stressors, a divorce or some sort of shock to the system. So, and then it will return, and with typically even more severe and difficult to treat symptoms. And the truth is that the pathogen has been in the background causing low level burden on the body all of this time, but has now reached it's been revived and it's reached a critical mass, and the body can no longer effectively fend it off. So often, or sometimes, what can happen is the development of autoimmune diseases at that point as well. So obviously we want to avoid all of this. So again, I come back to this concept of strategy and strategizing your Lyme recovery. And so we've talked about antibiotics quite a bit, and we'll turn now to the holistic strategies, which involve essentially the science and art of putting your body's natural strengths and capacities to work for you in the most efficient way possible. So this is something you want to do throughout your recovery process with Lyme disease. The goal of the holistic strategies that we put into place through the Uprooting Lyme Holistic Treatment Program is to outwit the enemy, right? The multiple infections that are depleting and weakening your body. So pharmaceutical antibiotics, I see them as like they're like the firing of cannonballs and missiles. Okay, they leave a wake of destruction. It's their nature. And since this battle is being waged on home turf, your body, your precious body, the question of how much of this type of warfare you are willing to wage is an important question. So in most cases, strengthening the body is a necessary strategy. Okay, this is really one of the primary takeaways I have for you today. Strengthening the body is a necessary strategy. It's really not optional, in terms of completing the attainment of long-term recovery from Lyme disease. Because antibiotics, they don't leave you in a state of optimal health. That's not what they do. They don't leave you off with a strong gut and a strong liver and a strong immune system. So, with tick-borne disease, this conventional antibiotic approach, while it may be important for many, it doesn't go far enough, not in the least. And so you have to recognize that there are complex contributors to your disease. There's complex mechanisms at work, and therefore that multiple strategies is needed to heal. It's also important to realize that what maintains or contributes to your disease progression isn't necessarily what started it in the first place, right? So it's, if the borreliosis started the disease process in the first place, antibiotics, yes, they are this direct attack on the borreliosis. But if you have tick-borne disease and you are chronically sleep deprived, or you are chronically stressed, or you are you have toxic congestion inside your body, these are actually the things that will contribute just as much, if not more so, to the progression of the disease inside your body, just as much as the fact that the Lyme is still there. So we need to prioritize dealing with those other issues, the sleep deprivation, the stress, the toxins, whatever it is for you that is, keeping your illness going. So that's a really important thing to understand as well. So, unless you're really strong constitutionally and you're already really working steadily to maintain a clean-celled body, you're really good at managing your daily stressors and tensions and emotions, there's going to be a level of diminished life force energy and flow in your body. And these are basically the places in your system where there's a weak link in the chain. And this is where the Lyme is going to be able to take advantage of you. And so what I do as a holistic expert in Lyme is to help you systematically identify the causes of that are contributing to your disease that other doctors and healers and specialists may have missed or just not known to look for. I can help you to make sense of it all and to understand what you can do to address the causes behind feeling so sick. And I help you to do everything possible to maximize your chances of an accelerated recovery and the return to a happy and healthy life. What we do through the Uprooting Lyme method is to renew your body's natural capacity to cleanse itself and to harness your powerful mind and emotional energy to align with rather than sabotage your healing. We engage in practices that restore your vital energy in a way that brings maximum support to the process of fighting infection, healing damaged tissue, and actually developing disease resistance so that you no longer are so vulnerable to entrenched infection. And I have to say that the knowledge and experience that we employ in this program is quite rare. So many people choose our program because they do not have access to this kind of help where they live. We work with people from all 50 states, Canada, Europe, living in the Middle East, and really all across the globe. So I want to share with you that at this time right now is actually a special opportunity. We typically don't have this opportunity available, so that's why I wanted to share this with you at the end of today's webinar, which is that the doors are open at the moment for just a couple of weeks to join our Uprooting Lyme 6-month holistic treatment program. And we open the doors for this program just once or twice per year. So we never have very many slots. And so to give you a little bit more information, we work in the group treatment program model, which is new to many of you. So, and we do this because in this way you gain the benefit of receiving in-depth teachings around physical and mental health practices that would cost a lot of money to be mentored in on a one-to-one basis. You also receive the benefits of connection and lateral learning that comes from the group experience within our community of positive, like-minded people who are pursuing this path of healing, and that actually we have people who take this program numerous times in order to continue with the levels of learning and the continuation of up-leveling their health over and over again as they heal from Lyme. So there's a lot of experience that's contained within our group of people. And then in addition to all of that, the program also involves the more traditional private one-to-one work with me, consulting and mentoring you to personalize your treatment plan. So, you can look at our treatment program page, and we do have a early bird savings available through this coming Saturday, February 20th. And so if you're interested and you would like to discuss your case, sometimes people feel that's necessary for them to make sure that they're really a good fit for our program, which I absolutely understand, then simply email us at info@uprootinglyme.com, and I'd like to have brief answers to these questions. So what are your present health challenges? And why do you feel that the holistic methods are the best for you at this time? And what has kept you from implementing them effectively before now? And then I would be more than happy, our team will set you up with a time for us to chat and see if we're a good fit for working together. So I want to thank you so much for joining us for the webinar today, and good luck to you, and I look forward to hearing from you. Bye-bye.